Hello, my name is Tinia Terry, and today I'll be discussing the decrease in the quality of life in brachycephalic breeds due to the increasing demand. So, what is the difference between brachycephalic, mesiocephalic, and dolichocephalic? So, dolichocephalic are breeds with elongated skulls, nasal passages, and narrow muzzles. As you can see depicted in this picture, it's a nice long bridge, and they do have those elongated skulls. Mesiocephalic are breeds with intermediate width skulls and proportional nasal passages. Brachycephalic breeds have a shortened or flattened face with a wide skull, narrow nasal passages, and a flat muzzle. And you can really see that in this picture. I know it's a little cut off, but his face ends right where the picture is. So, from a medical standpoint, looking at x-rays, you can see the difference in the dolichocephalic or mesiocephalic as far as like the nasal passage, how clear and open that is. Um, Their tracheas are nice and clear and open. And when you compare it to a brachycephalic breed, their nasal pathways are right here. It's a very, very short bridge, hardly any room through the mouth, and their trachea is very narrow right here. So it causes a lot of breathing issues for them, which um, causes a lot of other reproductive issues, cardiovascular issues, hypoxia, all within that. So another example, just looking at the nares difference, we would consider these normal. They're nice, wide, and open. They allow for proper thermoregulation and respiratory, just regulation as well. And then when we look at brachycephalic breeds, they're extremely narrow slits that don't really allow them to take in the amount of oxygen that is necessary. So the history of brachycephalic breeds is hypothesized that they were originally bred to have shortened heads to increase their advantage in bull baiting. Bull baiting essentially was like dog fighting, where the dogs would try to bite either the tails, the feet, or the face of the bulls, and they bred them specifically to have smaller skulls or flattened skulls to increase the bite force. So with these historical physical characteristics, they have been replaced with increasing demand for infantile characteristics now in today's society. The current gregarious temperament and small body frame make brachycephalic breeds desirable family additions. Extreme brachycephalic selective breeding. So, according to the Canadian Veterinary Medical Association, there has been a spike over the last couple of years in the popularity of brachycephalic breeds that produce exaggerated phenotypes. These include drooping eyes, corkscrew tails, large skin folds, um, and these extreme exaggeration of features leads to debilitating effects. Unintentional pressures from dog showing shows or kennel clubs can exacerbate the extreme phenotype because critiques decide what trends look best at the moment and not necessarily ensuring the safety and comfortability of the breed. So this leads to overtyping and brachycephalic breeds where they have a lot of these very extreme phenotypes. As you can see in this picture, the bulging eyes, shortened muzzle, very, very short nasal passageway. Um, and I found an anonymous article that was published in 2016 where it detailed the fears veterinarians faced when warning clients about the health defects of brachycephalic breeds and the pressure that they face. A lot of veterinarians agreed with this article when it was released, and a lot of them share the same sentiment of being afraid to advise clients not to get brachycephalic breeds due to their alarming and overwhelming health issues. And with the increase in demand, it just continues to exacerbate itself. So with that, the health concerns that really affect brachycephalic breeds are dyspnea, heat and exercise intolerance, digestive disorder, severe dental disease, pneumonia, cardiovascular strain, ocular disease, invertebral disc disease, brachycephalic obstructive airway syndrome, and decreased lifespans. And we love our UGA, but they also suffer. So dyspnea and chronic hypoxia, due to their shortened and flattened square skulls, brachycephalic breeds are prone to an elongated and thickened soft palate, a laryngeal collapse, which decreases the oxygen concentration in their blood. Their elongated and thickened soft palate obstructs the airway due to the tissues and causes excessive phonation, which we hear as the snorting, snoring, and grunts. This occurs because their soft tissues did not scale down proportionally when the desirable traits were selected and bred. These breeds attempt to increase their oxygen intake by sleeping elevated, open mouth breathing, just trying to find any type of comfort in their day-to-day lives to increase their concentration and increase their comfortability as much as they can. But with their small body frames, small heads, very restricted nasal passages, they really struggle to take in as much oxygen as they can, so they are left with chronic hypoxia. Laryngeal collapse can occur due to the compromise of the cartilage in the larynx and the trachea. Brachycephalic breeds can experience a laryngeal collapse as early as 6 months of age. And I want to just show a quick short video of just things that I've seen. All right, so in that video, you saw the Brachycephalic breed basically fainting due to hypoxia, not enough oxygen circulating within them. And a lot of owners regulate this behavior or regard this behavior as normal for them. And that's becoming more and more common. And that shouldn't be the case whatsoever. Instead of owners not really taking their health seriously or these issues as seriously as they should, it exacerbates the issues of them having chronic hypoxia. So going into heat and exercise intolerance, I found a study conducted by the Bailey Small Animal Hospital at Auburn University, and it is a 6-minute walk test, which was performed by veterinarians to assess the exercise tolerance for all breeds, but especially brachycephalic breeds noticeably struggled to meet minimal requirements. And those minimal requirements were walking 6 minutes up and down in an air-conditioned hallway, where they determined whether if they had any type of phonation, if they had increased inspiratory efforts, as well as noticeable signs of dyspnea or cyanosis. So as we can see in this test, brachycephalics got the highest grade out of all of them. So they have moderate to severe or severe respiratory noise, sorry. Also, again, respiratory, as far as inspiratory effort, moderate to severe and severe. And then as far as dyspnea or cyanosis, there was mild dyspnea, no cyanosis, and then in our extreme brachycephalic breeds, there was moderate to severe, and then severe dyspnea or cyanosis. So their conformation makes it extremely difficult for proper thermoregulation involving heat or exercise. And their mechanism includes panting, shaking, um, and they can't really sweat. That shouldn't be here, I'm sorry. So they do struggle with that. And because of their thermoregulation mechanism is interrupted, or impaired, it can lead to heat stroke, and heat stroke does not have a high probability, or a high chance of survival when they undergo that. It's a very stressful process. And like I said earlier, owners often dismiss signs of distress as normal behavior for the breeds, and they don't seek medical attention. So it exacerbates the issue even more. So going into brachycephalic obstructive airway syndrome, it is a partial or complete obstruction of the upper airways, where it is a combination of several chronic ailments and disorders. It is extremely common in extreme brachycephalic breeds, which include English bulldogs, pugs, shih tzus, French bulldogs, Pekingese, any breed with a shortened skull or flat face. BOAS can lead to airway resistance and an increase in negative pressure in the upper respiratory system. Negative pressure can cause edema of the nasopharyngeal mucosa, and these symptoms can be identified in brachycephalic breeds as early as 6 months of age and worsen with age and weight. And an issue that we often see in clinical settings is that brachycephalic breeds are commonly overweight, which again, really, really dramatizes the issue and makes it a lot more difficult for them to function on a daily basis. And these severe symptoms can lead to suffocation if not corrected. So there are a couple of treatments or preventative recommendations for brachycephalic breeds. They can be considered stressful and extremely expensive, so not a lot of people have undergone these treatments, but they are available. The most common that I saw in my research was rhinoplasty, and it can be conducted as early as 12 to 16 weeks to reduce consequences of BLAS. Tonsillectomy is not as common, but it's the removal of the tonsils. Tracheostomy, laryngeotomy, surgical opening of the trachea or larynx. Staphylectomy is the removal of the posterior soft palate, and the pharyngeoplasty is a reshaping of the soft palate to alleviate BOAS symptoms. So for the future of brachycephalics, the main thing is educating owners and communicating the health issues of the affected breeds and really just helping them to understand how severe it truly is and how it can affect them long term. We love our babies. We love and we treat them like family, so we want to keep them around as long as we can. So not exacerbating the issue of these characteristics that they're given because of their breeding and selectivity. We should be trying to reverse that and really educate owners on the proper reproduction methods. If they do want to get into breeding, just knowing how to manage that properly and having true regulations. Because there are no current regulations concerning extreme selectivity of debilitating phenotypes, and those mainly include the shortened muzzles and the elongated soft palates. Um, and with the increase of breeding, there is going to be an increase of workload on veterinarians. I've personally talked to veterinarians who say they don't particularly like to deal with brachycephalic breeds just because of the risk when it comes to surgical procedures. When it comes to just treatment of them, they are very chronic in all of their ailments, and it takes an extremely long time, and it's stressful for the patient as well as the owners, and it causes them a lot of stress. So as we see this trend continue to increase, we will see a higher demand for veterinarians to treat the breeds. And these are my sources. I hope you enjoy it. Thank you.